On behalf of Boulder Community Health, it's my pleasure to introduce this evening's speaker, Dr. Sherrie Ballantine-Talmadge. Dr. Ballantine-Talmadge is board certified in both family medicine and sports medicine. She enjoys utilizing her broad spectrum of training to care for active individuals and athletes as a primary care sports medicine physician. She completed her sports medicine fellowship in Toledo, Ohio. Her unique combination of osteopathic and sports training allows her to approach patients in a comprehensive manner, from the recreational to the Olympic level athlete. She has worked at 3 Division I universities, served as team physician at Northwestern University, and travels as a team physician with U.S. figure skating. She has also provided coverage at the Chicago Marathon and at the Kona Ironman Triathlon. Dr. Ballantine-Talmadge sees patients at CU Sports Medicine and Performance Center in Boulder. Welcome to Dr. Ballantine-Talmadge.
Thank you very much. I'm especially excited tonight. This is a wonderful time for us to celebrate a population that we don't often talk about. So welcome to our first ever equestrian sports medicine lecture, which we decided to call Staying Strong in the Saddle, Challenging Beliefs. So I'd like to start out tonight kind of telling you, like, why on earth am I here? Well, might all have started with this guy. And for those of you who don't know, that's Roy Rogers, otherwise known as King of the Cowboys. I grew up with him because of this lady right here. That's my mom. My mom grew up on a chicken farm, and my mom was a Roy Rogers fanatic. And so when she was a kid, she grew up riding her horse to the matinee at the local movie theater to see what kind of adventure Roy Rogers was going to get into next. So she was the first one that installed my love for horses. I took a break for a little bit from horses, and I took a different path and ended up being a sports medicine doctor. But a couple years ago, this little girl that you see in the picture brought me back to horses. That's my oldest daughter. That's her first pony that she ever rode when she was 2. That's called, that little pony's Baby. And so that's how I got back into sports medicine and have created this idea of equestrian and sport. How about equestrian sports medicine? So let's start off today thinking about, in Colorado, all the different ways that you probably could interact with horses. We live in Colorado, the stock show. So for many of us, equestrian looks like Western riders, barrel racers, all kinds of different things. Many of you have probably been on a trail ride before. As we drive into the Boulder back roads, you may see someone lunging their horse. It's beautiful, the Boulder mountains and the flat irons and a horse being worked with their owner, it's beautiful. You may be used to more English pursuits that you see here with dressage and cross country and eventing. Or maybe you like to watch Prince William do some polo. But then also maybe you've watched some Disney movies and you've seen Hidalgo and you're familiar with endurance racing, right? Or maybe, like mine, this was my dream. This is the Black Stallion and Alec. Maybe you dreamed of having your own black at some point in time. And then maybe you also are used to U.S. Equestrian and all of the different facets that come with eventing. And then maybe you've also been out to the Boulder Fairgrounds and seen 4-H'ers doing vaulting as well. All different kinds of ways in Colorado we can interact with sports. So let me challenge you. Equestrians, I just planted some ideas for you. This person right here, is she an athlete? What about these athletes right here, these equestrians, these riders? What do they have in common with Simone Biles? What do they have in common with this group of young men that I'm close to? That's one of our state championships for Boulder, or for Brimfield High School, where I'm the team physician. Or what about all the soccer players all over Boulder County and St. Vrain that are running around? What do our equestrians have in common with them? So this brings to our first belief. Do you really believe that riding a horse is exercise in a sport? What you'll find is that many people don't believe that. And sometimes even the riders themselves don't believe it. I love this little quote that we have here where they talk about equestrians and what they do. You run 1 mile, I ride 10. You play on a team. I play with a 1,000-pound animal that doesn't understand words. You fall a few inches, I fall about 7 feet to the ground. You have 4 quarters, I've got 2 minutes. That's more of like what you see with jumping. So who's the athlete now? So I would like to start to plant some ideas here about the fact that equestrians really are athletes and we need to treat them as such. This is a wonderful video that we're not going to be able to show tonight. It's pretty easy to go on YouTube, type in equestrian's not a sport. It's awesome. Please look at it. It really shows all the different kinds of riding and really demonstrates how strong these people really are, and the work that they do is so amazing. So there's a tremendous amount of health benefits that come from riding. These are just some graphics illustrating that. But one thing I'd like to point out that is really interesting, there's not many other sports that we have, and I cover a lot of them, that we know are actually used for treatment for conditions. So equestrian medicine can extend to a lot of our kids that are maybe having issues with mental health. We send kids to places where they can do riding or just interacting with horses. So we know that horses have a therapeutic effect, even if you're not riding them, just being around them. There's very little other sports that give you that because it's a relationship with another animal. There's cardiovascular benefits to it, right? If you've ever ridden a horse, you know your heart rate's not staying one level, is it? There's a lot of strength that is involved with this, and a ton of balance and postural awareness and core strength, right? So there's a ton of different health benefits all wrapped into one. And that's not even talking about the work that you do at the barn where you lift heavy pails of water, dumping it out, just taking care of your horse and doing things around the barn. So here's the next thing that we think about, right? So is an equestrian an athlete? Okay, what about this? If they're an athlete and they fall off that horse, what's the first thing that they think? I need to get back on, right? For all of you that are questions out there, I guarantee you that you all think that, right? You might have some interesting words to say to your horse after you've fallen off, but you're all gonna say, is my horse okay, right? I'm fine. I need to get back on, right? One of the interesting things that happens to us as team physicians for Team USA is every year we have the opportunity to go down and work all the NGBs, which is the national governing bodies of all of our Team USA sports. And we work together and we do workshops together. And there's only one other national governing body on Team USA that travels with a vet. That's US Equestrian. The animals get a lot of great care in the horse industry, but what about the athletes, right? You can't ride your horse that you're spending all this time and money taking care of if you don't have a body to ride with that horse, right? And what we know, those of us who love horses, this is about a relationship. That's maybe the thing that's so intoxicating for us about riding a horse. It's a relationship that we build. And so just like your mom or your dad or your partner can understand and see when you're hurting, your horse can not only see when you're hurting and when you're not yourself, your horse can feel it. And that's profound, right? So you can't ride if you don't know how to use your body correctly. So I fell off my horse. Is my horse okay? I need to get back on. Here's your question. Do equestrians themselves identify as athletes, right? This is a really interesting question. Well, I would say yes, but with some caveats. This is a wonderful study, and at the end of the talk, there are the list of all the resources where you can read these more in depth. This is a 2023 study from the Journal of Physical Activity and Health, and it was a study that looked at equestrians themselves, over 2,000 athletes, and it was their perceptions as to whether or not they define themselves as being an athlete. These were recreational riders, amateur riders, and professional riders. And the interesting thing, right, is that in this particular study, over 90% of the 2,000 people that were surveyed were female. Remember that. And also remember that there's a disproportionate amount, depending on the discipline of equestrian sports that you're pursuing, where there's a lot of females and young females involved in this sport. So what did this study find? So do the equestrians really identify themselves as athletes? Well, it depends. It depends on your level and how much you're riding. So recreational athletes, or recreational equestrians, I should say, or riders, when we talk about significant differences in scientific studies, we're talking about a statistical word here. That means that we found when we analyzed the data that there really was a significant difference. So for recreational riders, they are much less likely to consider riding as a sport and themselves as an athlete. As you increase in the amount of amateur, and by the time you get to be a professional, they definitely are more likely to think of themselves as athletes, which means they're going to treat their bodies like an athlete, right? Also, when they looked at barn work, so all the work that it takes to just take care of your one horse, let alone other activities you have to do at the barn, as well as equestrian physical activity, there is a higher perception in professionals that that equals physical activity and sport, right? So if you've ever been to a barn and weightlifted, right, you're not using free weights, you're using buckets, you're using water as you change that water out. That's weight-bearing exercise, folks, and especially for females who want to build peak bone mineral density, that's a good thing, right? So then, of course, it went down. And then by the time you were recreational equestrian, you were much less likely to think of barn work as physical activity. Then non-equestrian activities, so things where we would be cross-training. So not just doing your sport, but doing other things, same kind of relationship. The amateurs and the professionals were more likely to think about doing that versus a recreational. So the conclusions from this study is, yes, equestrian physical activity meets guidelines that qualify as physical activity that would be considered adequate across the United States. So all across the United States, we have physical guidelines that are set by a bunch of organizations that say what the bare minimum or what the recommended physical activity guidelines are. And this study and the work that equestrians do definitely qualify. Because of the fact that equestrian work is a lifelong sport, this also begs us to say that we should be doing things to encourage people who love to ride horses when they're young to be able to do it for their whole life, because it's a really great activity. So for us, one other really awesome thing happened then. In 2019, this is on US Equestrian's website, the leader of the organization at the time wrote a letter that student athletes or student athlete equestrians who are in high school could take to their colleges and take to places and say, hey, here's a letter from US Equestrian that says, I'm an athlete and I should be considered as such, right? That's a really big deal, because in some schools across the nation that helped these amateur equestrians be able to go to their schools and get equestrian programs in college, which was a really big deal. So if USA Equestrian says you're an athlete, then you're an athlete. So how do we stay strong in the saddle? How do we challenge this belief? So the reality is based on that study and other things, right? We have to keep these kids and keep people involved in sports. And so in order to do that, in this case, it's equestrian sports, we got to keep you healthy. You can't continue lifelong pursuit of a great activity if we don't keep you healthy, right? So we have to get you there. We have to get you there. We have to help you to understand that you are an athlete, and doing this work absolutely necessitates you being treated as such and you treating your body as such as well. And remember, again, like we said from the beginning, the thing for me that is mystifying about riding horses is that it's about that relationship. It's hard to explain it for any of you that haven't been around horses. It's kind of like your relationship that you might have with your dog or your cat, where they just, you can't explain it. It's a bond that happens that's so unique. And so your horse wants to keep that bond with you, but to do that, we have to keep you healthy. So sometimes, really, you guys, it doesn't make sense to just get back on your horse. So what about this next belief? Is there anything that we can do to prevent injury, right? Like, your horse is at like standing there and all of a sudden feels some grass and spooks and throws you off, right? How do you prevent that? Injuries in equestrian sports just happen, don't they? Well, what do we know about equestrian injuries? So this is really interesting. So keep in mind the fact that this is a sport that you can do for your entire life, right? So you can start out doing eventing and maybe change to trail riding. There's all different ways that you can continue to ride through your life. So when we look at the data and when you look at PubMed and you look at try to figure all these things out, you see there's a pretty large distribution of gender and what injuries correspond to what. So if you're looking at barn workers in a thoroughbred farm, you're going to see there's a higher proportion of men that are going to have injuries, right? But if you look at like some of the farms and the ranches around here or barns around here where you have a bunch of young girls that are learning how to do eventing, you're going to see 14 or younger than that pediatric patients up to like their early 20s having a higher incidence of females getting injured. So when you're looking, understand the discipline of equestrian and what you're pursuing is going to help to dictate which gender is getting what injuries. Age also varies according to the discipline as well. So it's not, and we know that you're going to get injured. If you're going to ride horses, there's a great chance that at least 50% of you are going to get injured at some point in time, right? It just depends on what kind of discipline you're doing. The other thing that to note is that injury can happen with horses at any time. Anytime. So you get your horse out of the stall and you're just walking and a bull snake walks in front of you, that horse could freak out, right? So there's things that we can do to prevent that, wearing a helmet all the time, right? It can happen when you're the trainer and you're standing in the middle of the arena and a horse spooks and you get hurt. So it can happen when you're on the horse, off the horse, anytime. Practice and even just doing unmounted horse activity. Environmental conditions is something people have looked at. So far, some of the studies say there may be an increased risk of you getting hurt when it's hotter outside, right? Your horse is doing a lot of work, you're doing a lot of work. Are we fueling that horse in the right way? There's some evidence about that. And of course, for those of us here in Colorado, sometimes it's just too darn cold and it's not safe to ride, right? So we don't ride. There are a lot of modifiable risk factors. I'm really excited to talk to you guys about that. So table that one, but there are modifiable risk factors that we can make better. Experience. This is a really fascinating thing to start looking at because your hypothesis would be that the longer you ride, the less likely you are to get injured. Experience definitely has something to do with it, right? So when you watch an early rider start to figure out how to post and canter and make transitions, there's going to be a learning curve for them, just like with any sport. Unfortunately, when they make mistakes, the injury risk is bigger here, right? But interestingly enough, sometimes the longer we ride, the more likely we are to get injured, the more technically difficult things we're doing and the harder horses we're riding too. So when you look at the literature, it's a little bit up and down about experience, right? You can get injury in either lack of experience or even when you're really, really experienced. But no matter what, when we look at everything in equestrian sports medicine and in the literature, number one cause of injury is falls, right? You're on a very large animal that's moving, whether it's walking or whether it's cantering, it's moving and it's pretty fast. So number one thing is going to be falls. That happens from unexpected horse behavior, which who knows, the wind blows and the horse spooks, right? You never know, right? But you can also have injuries, as I said, in unmounted activity, handling horses on the ground. So we need to be mindful that when we're going to focus our attention, we need to focus our attention with injury prevention and how to prevent falls, right? So prevention is huge. And it's so fascinating the more you get into this because you can see there's probably more here than we really realize, right? So there's some really nice studies. In this slide, you have a very new study that just literally came out, and I believe it was current sports medicine reports, brand new, right off the press. This is from a lot of people from US Equestrian, and it goes through equestrian sports safety, an update in safety equipment and event medical coverage. This is a wonderful article and goes through all these different safety measures, and this is a journal article that is published. What you can garner from this rider that's sitting here, she's outside. It's hot. I can tell you it's hot because I know when I took the picture. She is matched to an appropriate horse, but this horse is interesting because this horse doesn't necessarily always like other horses around him, but we know that, and the barn takes care of that. She has short sleeves on, which means she's got sunscreen on. She has her helmet on. She does have a riding vest on, and the tack has been applied appropriately. Those are all things that can be done to help keep this rider safe, right? So modernization of equestrian equipment has made a huge difference, right? Helmets, there's much more improved helmets. We're going to talk about that a little bit. Safety vest, properly fitting tack, safety tack, and even this noise dampening things for ear bonnets for the horses so they're not as likely to spook, right? There's some evidence for that. Appropriate rider horse match. You know, if you've ever been to a barn and seen a lot of kids riding, it can be really anxiety producing when you see a kid on a horse that is not really appropriately matched. It's scary. And so one thing I would be remiss if I didn't talk about was, you know, at our barn, like our kids practice emergency dismounts. I think they love it. But when you do an emergency dismount, it goes back to something my mother taught me from the time I was really little. Learn how to fall. And that's the case in most sports. But in this case, learn how to get off that horse quick and roll away from that 1,000-pound animal that could crush you, essentially. So learning how to make sure that the rider is matched with the right horse is really important, and we can do that. Education is huge, right? Every sport has a culture. And for this sport, as you'll see, I hope by the end of this time, we're not meeting the equestrian people and our riders and our athletes in a place where they're getting enough information of what really you can do to help things and improve the quality of the sport. That's what we want to do. So education is really important, and then proper use of equipment and making sure that tack is applied appropriately. So let's talk about helmets. So again, helmets are essential. Now, this is really interesting. When you take a deep dive on this, helmets are not required for all equestrian activity. For those of us that grew up in the 80s and the 90s, right, we rode our bikes all over the place without any helmets. Well, we live in Boulder County. Is there anybody around here that's going to get on their bike and not put a helmet on? I don't think so, right? So why would we put a helmet on when we go up to those mountains and we ski, but we not put a helmet on when we get on a horse, right? So there's cultural things with that. Are you riding English? Are you riding Western, right? Like, this is a big topic of conversation. It's only mandated in certain states, and horse riding and equestrian pursuit is global, right? It's everywhere. Interesting to note that in the European Union, there are pediatric rules in Germany and the UK about the use of helmets for kids. So that's interesting. But just realize that. You should be using a helmet, like I said, in mounted or unmounted activity because anything can happen when you're around a horse. Now, this is a fascinating fact. So helmets, they do reduce the amount of head injury severity, but they don't necessarily reduce the incidence. Okay, so swallow that just a little bit. So that means head injury can still happen, right? But the head injury that happens is not going to be as severe. So this is where you should be thinking about concussion, right? So you put a helmet on, and the helmet is there to make sure that you don't die, so that you don't get a brain bleed. That will kill you. You get a skull fracture that causes a brain bleed. So that's effective. This is a quote from one of the journal articles here. Since in the U.S. Olympic competition, it was required for helmets to be introduced, we've seen a 5-fold decrease in the risk of really bad brain bleeds, right? And reduced severity of the traumatic brain injuries that do happen, and also a shorter time in the hospital. So yes, are you going to get a concussion if you still wear a helmet? Yes. But are you going to die from that or have really severe consequences? You're going to lessen that significantly if you put a helmet on. But we still know, studies show us that helmets are not used regularly and they're not fit appropriately. So let's talk about injury patterns, since this is such a big deal with head injury. What we know is that now that we're using more helmets, we may be starting to see a little bit of a shift in the pattern that we see. So if you look up equestrian sports, you're always going to see head injury. You're always going to see thoracic injuries, like bigger trauma injuries, but head injury will always be there. But now with the use of helmets, you're more likely to start to see these long and big fractures of your upper extremities and lower extremities become more prominent, potentially, as we have more use of helmets. Other types of injury, we've already said helmet. So the number 1 and 2 is going to be head. Big fractures, like when you fall from a horse, you big fracture. So humerus and pelvic fractures, like things that can bleed, big knee injuries and femur. Laceration, soft tissue contusions, most of us will get something like that. Chest injury, abdominal injury, facial injury, like facial fractures. And then, of course, we do see spinal cord injury and spinal fractures. So that leads us to talking about the next thing, safety vests. So safety vests have equivocal evidence right now. We absolutely need more evidence. So as a physician, I have a kid that rides. Does my kid ride in a vest? Absolutely, she does. Do we have a ton of scientific evidence like we do for the helmet? We don't have as much. Interestingly enough, though, for eventing, which is a part of the Olympics, for cross country, with that, it is mandated that they wear a vest, and that's really helpful to know. So we do need more studies. Do I think this is a good idea? Yes. Do I want a little extra protection for my kid and for all kids and people? Yes, I do. But this is important. Look at this picture of this rider. So this rider she's on one of her favorite horses. She's got her vest on and she's got her helmet on. What's exposed that could be bad? Her neck. We still don't have anything yet to necessarily prevent pretty bad neck injuries. There are some of the vests that you may see that blow up that will provide some neck coverage, but we do need to keep in mind that the neck is still not something that is entirely covered yet with the safety devices that we have. This one is particularly fascinating and comes directly out of one of the journal articles that I reference at the end. I'm not sure, other than maybe like ultra running and some of our more extreme sports that we see in extreme sports medicine, this is a pretty unique safety thing for equestrian athletes. Wearing an approved medical wristband with the rider's name, contact number, their allergies, and serious medical conditions could be helpful in the event of a medical emergency. So if you're riding and you go on just a trail ride and you fall off your horse and you're on Eliquis, which is a blood thinner, and you pass out, you could be bleeding to death in your brain on the trail with no way to evac you, and someone could find you and not know what's wrong. So it's a really interesting idea that we have a sport where wearing a medical bracelet could save your life. So these are things that we need to be thinking about. This leads us into event management. So this is not something that is necessarily thought of all across the United States. I'm going to have a schooling show. I'm going to have this show. There's a ton of horse shows that are going on all over. Rodeos, it's the summer, right? So what do we know about event management in equestrian sports? So of course, the higher the level you go, so if it's USA Equestrian event or an FEI event, like you're going to have a medical plan. But most places are not going to have a medical plan. This is not a standardized standardized or recognized nationally what we need to be doing. And again, it depends on the discipline and the level of the competition that's happening. But bad things can happen at all levels, right? Because this is an unpredictable sport with a large animal. So when you're thinking about your event management, you need to think about who's going to be there, what's your coverage, what's your access point, all of these things. We know that equestrians carry this very high risk of pretty significant injury. So it's going to be head and neck, and those are things you've got to get to fast, right? So this is like, for me as a sports medicine doctor and like all of my colleagues, this is like sports medicine 101. You got to think about the worst case scenario. Larger fractures are going to happen. Your pelvis bleeds a ton. So you may be fine and be talking to someone, and then all of a sudden on the trail, lose consciousness because you've had a pelvic fracture and you're bleeding out into your pelvis. So therefore, we really would love to look at improving equestrian experience by talking about event management and emergency action plans. So in a couple months, football season will start. And up on the hill where the CU Sports Medicine and Performance Center is, we will all come together and we will practice event management. We'll go through emergency action plans. We'll practice on each other. We'll do different kinds of scenarios to practice what happens when the worst thing happens. Emergency action plans are something that we do all the time for all sports, right? But this is something we really could be doing for equestrian events that could make things much safer. Of course, again, at the higher levels, this is going to be mandated. There's three primary roles of an emergency action plan. Number one, as you see here, medical stabilization of transfer of patients that need more intervention. So again, what's your plan? You have an endurance ride that's happening, right? And you have people all over the place. If someone falls off and they have a head injury and a potential C-spine injury, which is a neck injury, how are you going to get them off of the trail, divert the race around, and then figure out how to get an evac out there? That's important, very important. It could save somebody's life. Triage and avoidance of unnecessary transfer to the ER. We're going to talk about this a little bit more in a second, but this is a huge role. How do we triage what patients are serious versus not, who needs to go to the ER, who doesn't, right? What can we handle and then follow up as an outpatient? There's a lot. Lastly, basic first aid. Basic first aids, I felt I can, throw some glue on this or put some bandages on. And then also deciding, are you there to treat the spectators? Are you there to treat other people that are part of the event as well? So again, I talked about modifiable risk. This is your modifiable risk. It's so awesome. By a little bit of some forethought and some discussion, you could potentially prevent something from being really bad. So when we talk about event medical coverage, do you need a sports medicine doctor like me at all events? Probably not, right? You could look for an EMT, but you could look for my friends. You could look for a certified athletic trainer. And most people don't know what an athletic trainer is if you're not in a traditional sport environment. Athletic trainers are certified medical providers that have master's degrees, and they are the expert at everything I just said. They know how to make emergency action plans. If those of you have watched football, you see those athletic trainers, those are the ones that are right onto the field. And we work as sports medicine physicians with them in tandem. I would tell you my athletic trainers, wherever I go, whether it's in the world with Team USA or on a football field, they are my left and my right hand. They are with me at all times. So you may want to think about having, when you are creating an emergency action plan and event management, find an athletic trainer and pay that athletic trainer. That athletic trainer can help you create your emergency action plan. They can help you to make sure that people are appropriately taken care of. Nothing bad about EMTs, it's totally fine, but just remember there's two different things that you get. The athletic trainer is the perfect person trained for those kind of events. Transport considerations, how are you gonna get an ambulance in? Is there a backboard? How are you gonna get that person out of the environment? In the mountains, in an arena, all different kinds of things to think about. Exposure, right? That's something, if we're out and doing some desert race, that's gonna be important too. Access and safety of the covering medical provider. So if I'm covering something, I need you to have had a conversation, or at least I need to be aware of that horse. I'm running in to take care of the human athlete, but you do need to have a conversation of who's going to get the horse. I'm not going to go run out into a barn or into an event that I'm covering if I don't know where that horse is, because I don't need to get trampled too. So having a conversation of who's going to take care of that horse while you're trying to get to the athlete, right? AEDs, right? This is like everywhere. You walk in DIA, they're everywhere. Can you get an AED to your barn? Do you have an AED at your event, right? This is going to save lives. This is something that we've also been talking about at the barn and talking about also for every barn, having an emergency medical bag. As sports medicine physicians and our athletic trainers, we carry a medical bag with us. When I travel around the world with Team USA, I carry my personal bag, and then I've got this huge suitcase that I'm basically traveling with a medical office, right? So having something like that at the barn that you could utilize to help your athletes while they're getting injured or at an event could be really important, and the development of that is something really helpful. And then lastly, know who is BLS trained. These days we talk about hands-only CPR. You don't have to worry as much about like mouth to mouth, right? We need to get blood up to that brain. So things for barns to think about, getting their trainers certified in BLS and making that a priority. Barn safety, but barn safety because of the people that are training the kids at the barn, they're gonna be safe and they can keep their riders safe too. This is a picture of some of the vests. And then you see our wonderful Jackie. Jackie is our athletic trainer who has kind of become our barn aficionado. She's our athletic trainer that goes out to cover some of our equestrian events, and she's really enjoying it. It's been really fun to watch her interact and learn something new. And this is an example of a cross-country rider that has a vest on when he's being safe and riding a cross-country event. So if we're gonna stay strong and we're gonna challenge beliefs, reality is injuries are going to happen in equestrian sports. They're going to be different than when I go to the soccer field or the football field. Well, we're still going to have head in those sports too, but you're going to see head, abdomen, chest, and maybe bigger fractures, bigger, more bleeding fractures. But there are things that we can do to help to prevent them from happening in the first place. And then the most important thing is we may not be able to get rid of all the injury risks that we have in equestrian sports, but we can decrease the severity of them by planning, educating, and making emergency preparedness a priority, making a medical bag that we could help somebody with, and create those emergency action plans. I cannot tell you how important that is. So let's talk about this little guy. Let's say this little guy, he wants to ride. He wants to do riding. He's gonna be an equestrian for his life. There's no PPE that he needs. So what's a PPE? So in 2020, we learned a different definition of a PPE. It's not personal protective equipment. But this, for all of you that are watching that are in the equestrian world, you're gonna laugh here because in the equestrian world, we have 3 definitions of PPE, don't we? We have a pre-purchase exam. So there's definitely a lot of jokes here. Before you buy your horse, you take that horse to the vet comes and takes a look, is this a sound horse to buy, right? So you get a PPE for your horse. Shouldn't you get a PPE for the rider of that horse? PPE is a pre-participation exam, physical exam, and you may be used to if you have other kids in the house that have to go get their paper signed to go play at BVSD. So I just wanted to put a plug in here. Right now, there's no standardization for this, and we see this with a lot of decentralized sports. Dance would be another one as well, where you don't need a physical. And so I would say adults and kids, anyone that's riding, you should let your primary care doctor know that you're a rider. Even if your primary care doctor doesn't know anything about riding, it might prompt them to ask you more questions at your physical. Have you had head injury? Do you feel okay with that? So even if they don't know, if you don't bring up your riding to your primary care provider, pediatrician, internist, you're robbing them of the opportunity to potentially help you. And then if there are unresolved issues or they don't know what to do, that's a totally great time for you to come find sports medicine. And sometimes even that, depending on where in the country you live, maybe that sports medicine provider doesn't know much about horse riding and the event that you're doing, but they do know about sports and they can help you to find the right thing, get the right diagnosis. So this is a little plug for just being mindful of telling your healthcare providers that you're a rider so that they have the opportunity to help you. Okay, here comes the big one. Okay, drum roll, right? Okay, so I think I got a concussion, but I don't know what to do or who to tell. I guess I'll just keep riding. You know, it's just a ding, right? Get up, back on the saddle. And oh, by the way, there's nothing you can do for a concussion, right? So I'm just gonna keep riding. Well, are you ready for this? So get ready to sit your riding pants down in your chair. This is astounding fact. So when you look at concussion and you look and compare riding to football, ice hockey, and rugby, who comes out on top? Equestrian. That's crazy, right? You're not reading about this in the New York Times. All this concussion stuff that you've been reading is about football and about other things. Are you hearing about this? Are you hearing about the fact that horseback riding has a higher incidence of concussion? That kind of blows my mind, right? So how are we going to help this? How are we going to make this better? The reality is we also have a problem that most of these concussions, or a lot of them, are happening in private settings, somebody's barn, and there's no way to report that. There's no national organization that's going to track equestrian concussions, right? So I just want to tell you, don't panic, because there's no way I can cover what we need to about equestrian concussion in a couple of slides. So we have another lecture coming. It's on August 26th, and that's our kickoff for the fall. And we do a whole lecture on the best way to handle concussion. So what can I give you that are nuggets that you can sink your teeth into? Rapid fire concussion. Okay, ready? This can happen with or without a helmet on. Remember that a concussion is going to happen from the inside out, right? It's your own brain that's hitting the inside of your skull. So remember what I said earlier, the helmet's there to keep you from having a brain bleed or a skull fracture, right? You don't have to hit your head to get a concussion. So every year we talk about this. You're going to have a whiplash injury that then produces enough to give you a concussion. Every year we have a kid that falls really hard on his or her bottom, and it goes up through the CSF, through your spinal cord, and gives them a concussion that way. So I want you to be familiar with a couple of these terms here. When we're talking about concussion, in this case, we're talking about sport-related concussion, not motor vehicle concussion, and not military veteran, like blast concussions, right? I want you to hear and know the word gradual return to play, return to learn. These are all things that are really important that you'll hear about more later in August. Now, here's a kicker. A concussion may or may not involve loss of consciousness. In fact, loss of consciousness does not, again, loss of consciousness does not dictate the severity of the concussion. We have a ton of patients who have no loss of consciousness and have awful concussions, okay? And then the evidence is clear with this. The sooner we see your athletes with a concussion, the faster they're gonna get better, the faster they're gonna get back to their riding and their sport, right? Very commonly, concussion can resolve in a couple of days, but there are ones that can be more protracted. And then again, here's another pearl. Remember, nothing is seen on MRI. So when you have a multi-trauma event and you fall off of your horse and you could have a fracture and you go to the ER, and the ER doctor does what he or she should, which is give you a CT scan, that CT scan is there to make sure you don't have a brain bleed or something that could kill you. The concussion will be managed and talked about later, okay? So speaking of the ER, just another pearl, the ER is not where you go to get your definitive management of concussion. Concussion is an outpatient diagnosis that needs to be managed long-term, okay? The other thing that would be really helpful for your barns and for your trainer is written communication so that they know what's going on. And then gone are the days where we have you sit in a dark room and do nothing, right? This is active management of concussion. Because if you get it taken care of soon enough, you don't end up with this, post-concussion syndrome. This is really rough for us in this sport, right? It's really rough in all sport to get post-concussion syndrome and be pulled away from your sport, right? But in this sport, there's a significant risk here. If you go back to riding up on that wonderful horse that you love so much, and you're not totally yourself, and you can't sit in that saddle, and you don't know where you are in space, and you have vertigo, and you don't know if you're coming or going, this is unsafe. And so you can see long-term effects here that are psychological. You mourn the loss of sport. You mourn, in this case, I would argue it's so different than my other sports, because now you're also mourning the relationship that you had when you were riding with that animal, right? So you may still be able to take care of that animal, or you might be so afraid you can't even be around that horse. So not only do you lose the sport, but you lose your relationship, which is like, if you know horses, that says something to you. So you can even have impaired ability to read. So get your concussions dealt with so you don't end up with these struggles. This is awesome. This is hot off the press. Again, US Equestrian just this year has now come out with their official guidelines for equestrian specific return to sport. So this is again on their website. You can access it. It takes our international concussion guideline and applies it to a sport specific way just for equestrians. So if you're a doctor or someone that is in the healthcare profession and you're watching and you know nothing about sports, grab this, and then you can interface with your equestrians and help them to make that more sport-specific return to play. So this is a wonderful, we're so thankful for US Equestrian for putting this out. Okay, almost to the end of concussion, it's a huge topic. So this is Jake Snakenberg, for those of you who don't know. And in our state of Colorado, we have the Jake Snakenberg rule, or law, I should say. And this is the idea that when you have had a concussion, you cannot return the same day to play. Unfortunately, Jake passed away. And so we have laws across all states. So if you, as a trainer or a barn manager, feel pretty uncomfortable with a kid returning and everybody's freaking out, you can just say, like what we tell our coaches, our refs, and our fellows, it's a law. So they can't return that same day. They've got to be seen by somebody that's a healthcare professional that can help them. So that's really important for you to know. And there's a reason, because we want to prevent outcomes that could be awful. So in our challenging beliefs here and staying strong in the saddle, get your concussions looked at. Treat them sooner rather than later. What do we need to do to help our sport that we love so much keep kids in the saddle, make it a lifelong endeavor, stay with it for our whole lives so we can enjoy it? We need to educate, we need to recognize, and then we need to remove, right? And then I just want you to realize that when we take care of concussion, it's a multidisciplinary approach. So it's not just me as the physician saying you can't do this and you can't do that. It's a team approach of the rider, the trainer, the parents, it's everyone. It's multidisciplinary how we get you back in the saddle. Okay, as we're coming towards the end of our talk, all right, I had a fall, but now I'm scared to get back on. What do we do with this? There's pretty significant psychological effects that happen for us because this sport is so different. Getting back on your horse, there may be things that if you've fallen and you haven't come back after a major fracture, after a patellar subluxation, after a head injury, you might be thinking, did you really recover all the way? You know as well as I do that that horse will be able to tell when you get back on if you feel the same way as you did a couple days ago. So does this put you at increased risk for future injury? Absolutely. We do have some studies that show that after you've had concussion, just concussion, within the first 6 months after that concussion, you're more likely to have another injury, ACL, something like that. Well, we don't have that study specifically duplicated in equestrian, but we know that that's true in general. So if I don't feel like I'm all the way myself, I'm going to get back up on that horse again? I don't think so. And I might not even know who to go to get help with it. So that could be very hard on me emotionally. So are you on the right horse? These are questions you should be asking. Are you modifying your riding right now? Does your horse feel your nerves? Are you starting to get performance anxiety? And then who can you talk to about this? Many injuries can get better the sooner that you treat them. And there's a lot of consequences to not treating an injury soon. There's specific return to play considerations for almost every injury that we do in sports medicine. And then this is one that's really important, right? If we're going to make a difference in this sport, we want to educate kids and grow them with the right thing. So kids think they're invincible. Yes, kids bounce, and maybe I don't anymore, right? But if we can teach them to talk about their injuries and get treatment sooner, we can prevent long-term consequences of chronic pain, loss of range of motion, and arthritis. I know this, even in my sport, I've got all kinds of injuries. There's no surprise why I'm a sports medicine doctor. I got a lot of the injuries that I treat, but you pay for it later in life, don't you? So this is an example of scoliosis for you guys so that you can see like the way that your spine moves is really important too. If you have scoliosis or a kyphosis, like you see where you're more like a hunchback kind of, this can affect the way you sit in the saddle. So identifying this and then figuring out with your physical therapist, like how can I do this? How can I make these modifications, right? Early identification of joint issues, spine issues can make a significant difference in how we control our bodies when we're sitting on that horse, right? So the longer we have pain, the more we change the way our bodies move, which is going to change the way we get on that saddle, which is going to change the way that we ride, right? And how that horse feels us. And that's true for acute and chronic injuries. And acute and chronic injuries change the way our muscles work, right? So these are important things to be considering. Well, let's take an example of knee injuries, right? Okay, many people are going to have knee injuries. Knee injuries can be sprains, subluxations, dislocations, fractures, all kinds of things. But a lot of these things, if you don't take care of them, you can't throw your leg on. You can't squeeze that horse as much anymore. Your trainer's saying, get your right leg on, get your leg on. You can't because you can't activate the muscles to do it. So if you can get these things identified, you won't end up like this patient that we're seeing here that ended up with bilateral total knee replacements. So there are plenty of things that we can do. And gone are the days where we just put steroids in things. There's certain times where steroids are appropriate, but we can do things like hyaluronic acid injections. And this is kind of a fun one to talk about equestrian people with. So platelet-rich plasma, which is part of regenerative medicine, has a strong root in veterinary medicine and in horses, no less, right? So there's a lot of things that we can do to help preserve your joints so you don't end up needing a total knee replacement. Working on things like core stability and strengthening, hip strengthening, right? You can't get that leg on if you can't activate the glutes to get your hip to fire to bring that leg in onto your horse. Spine motion awareness we talked about. So rider preparation is something that's key. You know, we warm our horses up. When I watch and sit at the barn and watch my daughter, she doesn't just go out and start jumping 2 feet, right? She warms up. She does a little walk, then she trots, then she canters. She works on her transitions. So we warm up and we cool down our horses. Shouldn't we be doing the same for ourselves, right? But we don't. So how do we challenge these beliefs, right? So early identification of injury, getting into the right person, knowing that the sooner we get these injuries taken care of, the better we're going to do long term. We can even look at injury risk mitigation and future injury by getting our injuries treated sooner. And then also maybe even stopping some of the psychological effects that can happen to us when we get to a point that we just can't ride anymore. So learn who your healthcare professionals are and then use them, right? Okay, so last thing here on this one, ever since that one fall, I just can't ride anymore. I'm just so sad. This is, we've mentioned and talked about it in different forms, the loss that you have, performance anxiety, you may be thinking about getting hurt again, and you've had just like one too many. Like if I get back up on that horse, I'm gonna have one too many, and then I'm gonna need my knee replacement replaced. I'm gonna need a revision, right? There's a lot of fear of the unknown because there's this aspect of the sport that we just can't control, right? This is another being, a life force that can think and do things on its own. So there's a lot of considerations when we think about this. And so again, many times riders aren't telling doctors about what's going on with them because they don't want to be pulled off, right? But if you don't tell your physician, you miss out on the opportunity to maybe help prevent something that will take you away from something that you love. So injury treatment also can then translate into sports performance as well. So once you learn how to get your injuries treated and you're working with your PT or your athletic trainer, we can give you home programs to keep working, like you finish your injury and there can be specific things you have to work on for what your spine looks like or what your injuries are. Creating a warm-up and a cool down that's specific for you. These are all things that we do for our athletes, our other athletes. We should be doing it for you guys too. Better understanding here that the pathology or the problems that we create that's going to create a better relationship between you and your horse, right? You're taking your horse to the vet to get your horse taken care of, right? You want to take yourself and get cared for so that both the rider and the horse can be one, so they can be at their best. That's so important because it's going to empower you and your horse. Your horse can feel when you feel confident, right? So there's understanding that there's return to play for certain injuries. And like our goal as a sports medicine team is that you ride well and that you ride safe. So I'm an equestrian. I expect to have these issues with my body, right? It's just a given, right? I do rodeo. I'm going to be broken by a certain amount of time. I don't know. Do we really need to think that? No, not based on what we just talked about. Creating exercise program for prevention and treatment, basing our decisions on previous injuries and giving people proper progression. Functional movement exam where we say, hey, you come into the office and you say like, hey, my trainer keeps saying the same thing over and over again. I don't know how to fix this. I keep trying to fix it, but I can't. What's wrong with my body? How can you help me to perform better? I don't even have an injury, but my trainer keeps telling me the same thing over and over again. Incorporating rider-specific activity could be really helpful. So this picture here are two young ladies that are using a pole, right, that we put up for jumping, and they are going there to camp, and they're going to do cross training, but it's going to be rider-specific things. So you're going to maybe do some posting. They're going to do some jumping back and forth. So you can make rider-specific cross training that your kids or you or whoever is riding can do when you're at the barn, right? So you've got your horse tucked away, you got the blanket on them, they're set up, they've got the grain, they've got their hay, they're eating. So you can take a little time and do some sport-specific training that translates not to something we would give a soccer player, but what I give to somebody that needs to bounce all the time. It needs to move, it goes pretty fast, and we need to work on hand-eye coordination and body awareness. So that's really important. There's lots of different things that influence how we sit in that saddle, how you post, all these different kinds of things. So understanding what our spine is doing, working on our neuromuscular firing patterns. These are all things that translate not into injury prevention only, but also sports performance as well. So things that we can do here is challenge these beliefs that we can utilize sports medicine. We can create programs for ourselves to not only take care of injury, but do sports performance, prevent injury, make us better riders by challenging and understanding that at the core of this, equestrians are athletes too. And everything that we do for our soccer players and baseball players and gymnasts and figure skaters, we need to be doing for this patient population as well. So education, real dialogue, and understanding what's happening and where your resources are is really important. I would challenge all of us in a position where if you are in a position that you can make a difference in this sport, talk, lots of open dialogue, teach kids early, train the trainers, right? all these things are things that we say in all different kinds of sports. We do a lot in concussion teaching and awareness, but we can actually make a difference in the sport and make you stay in the sport longer and help you to have a great experience. So we have a couple of quotes here from some of our patients that helped me to put this together that I would like to read for you because I think they're poignant. So this one says, sports medicine is not just for the young competitive athletes. As an older person trying to keep going and stay fit, my sports medicine doctor treats me with compassion, understanding, and collaboration of how to get back on track. It's a two-way dialogue, which is important to me. Sports medicine doctors understand the psychology behind being injured and having active personal goals. After the ability for my body to function optimally was compromised, seeing a sports medicine doctor helped me develop a comprehensive game plan to reach my activities and goals. From orthopedics and physical therapy to metabolic evaluation and concussion, sports medicine is a more comprehensive medical specialty. It's probably my favorite. I hope I can get this to go. I'm just gonna let this equestrian speak for herself. Is it working? Video. Can they hear it? Uh-oh, they can't hear it? Okay, wait. Ooh. Wait, do I have to turn it up?
Yeah, you might have to turn
Me?
the volume on the computer.
Uh-oh, turn it up. It's all the way up. Well, leave it to computers, right? I'm always scared when I put videos in. If you can't hear this, can we tell? We don't know. Okay, we don't know if you can hear it. I hope you can because it's wonderful, and we'll be able to access this later. This is one of my equestrians that I've had the luxury of taking care of since she was a young teenager, and now she's in college. And she's talking about the benefits of what it's like for her to have learned how to use sports medicine, how it's changed her as a person and as an equestrian. So I guess I should just let it run in case they can hear it. Just they can't. It's not coming through.
Yeah.
Okay. I'm sorry. It's really great. I hope there's a way for you to be able to hear it. I guess it's just an incentive for you to watch this lecture again. But this is the athlete voice, and that's what's really important. So here's my last one for you. This is kind of meant to be funny on purpose. So here's a belief. Once you say yes to letting your kid lease a horse, that your kid will be happy. Yeah, no, I can't challenge that one. That's a total myth. And what I can tell you is once you say yes to the lease, then they say, well, now I want to buy a horse, and then another horse, and another horse, and another horse. So I leave you with a couple of things here, some really wonderful things just for those of us that are love horses and try to understand. You know, for me personally, it's about the relationship. It's about the team. We did have another quote in here too, that doctors heal bodies, but horses heal your soul. I can tell you through many journeys and parts of my life, I've had horses heal my soul. And so I would be remiss if I didn't end our talk with my friend Roy Rogers and his rider rules. Now, maybe he wouldn't tell you these rider rules for this talk, but he might say this. When you're young and fall off a horse, you break things. But when you're my age, you splatter. I hope that you don't splatter. I hope that we can take all of this and we can learn and grow together. Lots of thanks here for all of the dads and the moms that spend hours at equestrian events and closing their eyes and being worried. I have to thank Triple Creek Ranch and all the trainers and Lynn. I can't thank all of you, my patients and the families that have helped to create this. We are so excited at the CU Sports Medicine and Performance Center to allow equestrians from all over to have the knowledge that they are athletes too, and partner with you to help you have a better riding experience. So I have to also at the end, thanks all horse lovers everywhere, and of course my mom and my daughter, because she was worried I wasn't gonna thank her, but I'm thanking her. Here's the references for you guys. There's a lot of great ones on here. I really hope that you can go back and that you can look at the videos that were on here. They were really good, and I hope that you can hear Kaya talk. That's Kaya Thomas, and her words are really powerful. I'm so excited to hear your questions and to continue to go on this journey with you guys.
Thank you so much. So much good information just packed in there, Dr. B. Thank you for that. We did want to remind our audience that now is the time for questions. So if you have any general questions, please put it in the chat box below the screen that you've been watching, and we'll get to as many as we can. In no particular order. There are so many horse and rider trainers out there. Some are good, some are very bad.
Yeah.
Why are there no certification requirements for trainers? This is a disservice to the industry.
I mean, I think it's a great point. I will speak as a parent first, and then I'll speak as a sports medicine physician first with my colleagues at US Equestrian and other places. As a parent, I'll just speak for like Boulder County around here. I've already had that experience. I know exactly what that's like, and there's zero way for us as a parent to figure out if a place is good, let alone like I came into this with some knowledge, right? And so you're exactly right. And what I would encourage you to do is when I saw things that I didn't like, and granted, I understand I'm looking at like my kid's experience, that was their first experience with a little bit of a different view, right? Because I am a sports medicine physician, but as a parent and as somebody that's engaging in a very potential dangerous sport, it's you've got to get away from those bad trainers, like, and that's not okay. And so it's really hard to know, and so sometimes you do have to go through a couple of barns and have some bad experiences. I will say that within US Equestrian, there are certifications, there are different levels and things you can do, and there's safety task force within US Equestrian. So it is important, I would say, to look at the barns and look at the trainers that are at the barn and their qualifications. Those that have more advanced qualifications are going to tell you. We are very fortunate at our barn that our lead trainer is very much involved in safety with US Equestrian. And that is amazing. And I feel so lucky, but you're right. And you can't afford to make a mistake with this. And I agree with you. It is sort of a chaos out there because anybody can open a barn and grab some horses and say, I'll teach you how to ride. So it's tricky, right? We call it in Team USA and in the world of sports, these are decentralized sports. So it's just like club sports with soccer, right? I've got rules for our BVSD soccer, but you go to club soccer and you don't have an athletic trainer all the time. So there's all kinds of places in sports where things fall apart. You're right.
All right. This person said that they've talked to a lot of trainers, and older trainers used to teach emergency dismounts that you mentioned. They noted that newer trainers don't. Is this because of insurance liability?
That's a great question. I don't know. I can't say. I don't know why they wouldn't do that because our barn does. They teach that right away. It's, as I said, something that I grew up with my mom. For those of you that don't know, I also do a lot of figure skating work. I'm team physician she mentioned it, for US Figure Skating. When kids first start to fall, we teach them how to fall. So it's something that we should be teaching, but I would ponder this, right? Isn't this part of our culture problem that we have in this sport? Sports medicine needs to come meet you. We need to get out to those barns. We need to create this field of equestrian sports medicine so we can educate again. Like, we need to get the trainers updated on concussion and all these kinds of things. So from my personal experience, that's happening at my barn. I don't know why it wouldn't happen because it's a very simple thing to teach, right? In all sports.
Are physical therapists trained in equestrian sports injuries?
Yes, oh my gosh, thank you so much for asking this question. So we are so fortunate. So in physical therapy, you have all different kinds of physical therapists. And then you have sports physical therapists, and they can even take extra certification. Like at our program, we have a residency, and they can do even more training in sports. But even within sports medicine physical therapy, you can do additional training, and like, let's say we do it like in dance medicine, we can do. So we're pretty fortunate that at our center that we have some people that are equestrians, and so that's really helpful. If you're watching from across the country, what I would say is very similar. I feel like there's a lot of similarity in equestrian sports medicine to dance medicine, which is something else that I do. And it's all these places where we don't have a structure to get access to sports things. So you can call different physical therapy places and say, do they have experience with equestrian? And what you'll find is like 9 times out of 10, performing artists and athletes all over, if you're working with a sports medicine physician or a physical therapist or athletic trainer that doesn't know your sport, if that healthcare provider says, I don't know much about this, can you tell me about it? That can be a wonderful window too, because most of the time, if you're a solid sports person, you can take what we know in sports medicine and apply it to almost everything. So it's a partnership. Again, I'm saying thank you so much for asking it, because it's really important.
Okay. I think we have time for just one more question, and
Great.
then we're going to have to wrap it up.
Okay?
Are MIPS helmets really better than non-MIPS? Let's assume that the helmet is fitted properly.
Great question, and I was figuring this question was going to get asked. MIPS technology has definitely improved helmet technology all over the place, right? With cycling as well as with skiing, like in these high-risk sports. So MIPS helmets are good; they're really good. But again, remember, why are you buying a helmet? That's the key. I really can't emphasize to you, and granted, it's probably significantly biased because of being a sports medicine doctor and doing so much with concussion. You're buying a helmet, and as you said, it's going to be properly fitted, but you're buying a helmet that's a good helmet to make sure that you don't get the injury that's going to cause you to die or have lifelong impairment. So please don't go out and think that you can buy any technology, even if you're a family that has a football player, a soccer player, and an equestrian in your home. There's zero that we can put on yet to prevent concussion. So please, yes, MIPS are good. That's great. But remember that you can still get a concussion even if you're in a MIPS helmet.
Okay. Thank you very much for answering those. We have come to the end of our time. A recording of tonight's lecture is available at bch.org/livestream.